Scotland's NHS brain drain as nurses quit to work overseas. Damning figures reveal more than 1,800 nurses and midwives trained or living in Scotland have sought paperwork allowing them to be hired by an overseas employer over 5 years. The findings come amid a recruitment crisis fueled by rising workloads and low pay. Last month the Royal College of Nursing, RCN, Scotland warned more than a third of professionals are looking for another job. Official statistics show 4.5% of nursing and midwifery are vacant, a rise from 4.3% a year ago. Nursing leaders argue staff are under increasing pressure because of the shortages, with the NHS already creaking at the seams. The new data from the Nursing and Midwifery Council, NMC, shows there were 1,877 Scottish-related verification requests made between 2012-13 and 2016-17. Some 1,272 had an address in Scotland, while 1,728 were trained north of the border. Scottish Conservatives, who obtained the figures through a Freedom of Information request, said the situation was alarming and called for more action to encourage nurses to stay in the country. In October it emerged almost 3,000 doctors have left to work abroad since 2008. Scottish Tory health spokesman Miles Briggs said, "At a time when recruitment is so challenging, the last thing we need is Scottish-trained nurses upping sticks and moving elsewhere. Clearly more needs to be done to incentivize them to stay. Otherwise patients and the staff left behind will be the ones who suffer the consequences." The SNP can't point the finger elsewhere. It must try to attract nurses who've left back to Scotland, and do more to make sure others don't leave in the first place. We know the SNP are presiding over a brain drain in general practice, but it appears they are also presiding over a brain drain in nursing. The NHS staff crisis is set to worsen with almost 1 in 5 nurses now aged 55 or older. Last year, 18.8% of nurses and midwives were 55 or over, up from 17.1% 2 years ago. Norman Provan, Associate Director of the RCN Scotland, said, "The prolonged pay freeze and workload challenges are adding to the anger of nursing staff who are working under enormous pressure, constantly being asked to do more with less." Scottish-trained nurses seeking to work abroad is not the biggest issue facing the health service in Scotland. To avoid an even greater shortage of skilled nurses in the future, we need to find new ways to make nursing an attractive career choice. Scotland needs a robust workforce strategy that future-proofs the nursing workforce across hospitals and communities. A Scottish government spokeswoman said, "This government has delivered an all-time record-high number of staff in Scotland's NHS, including more nurses. But Brexit, and the UK government's determination to end free movement of workers, threatens our ability to continue to secure skilled staff for our health service."